WMFD.com. It is Coffee Talk with Jay Fox, brought to you in part by the Cove Coffee Shop in Ontario, Ohio, offering dine-in and to-go and curbside carryout during this pandemic. Today, we are talking with our friends from Third Street Family Health, and joining us on the broadcast today, Peggy Anderson, who's the CEO, and Katie Griffith, who is the Director of Nursing. Welcome in, everybody. How are we doing today?
Doing well. Thanks for having us.
Oh, absolutely. So, Peggy, provide me with just a brief overview. What is Third Street for people who don't know?
So Third Street Family Health Services is a community health center. So we're here to serve really anyone who doesn't have or who needs a healthcare home. So if you need behavioral health care, if you need primary care, if you need OB care, dental care, we are here to provide just care to the community, good quality care. We provide the outreach and the connection to other services or benefits that folks may need. And we certainly have, we take all of the major insurances. So while we're here to serve those who may not have the ability to pay or don't have healthcare coverage, we take all insurances and welcome everyone who needs care.
Are you guys at capacity right now?
No, we can certainly take more patients. Some of our services are, you might have a little longer wait just based on the volume, but we certainly have access to primary care, dental, behavioral health. We have all of those and can take folks at any time.
So we've now gone into month 10, maybe month 11, of what has been the most unusual year of most of our lives. How has COVID impacted Third Street in terms of volume of service? Have you seen a tremendous spike in need for care?
Yeah, what I can tell you, and I'm going to have Katie also speak to this, we see different things in different departments. So with dental, and particularly because dental kind of shut down other than emergencies for a few months because of the governor requiring that. So certainly dental has fallen this year in regards to the volume of visits. What we saw in behavioral health, however, when we went to telehealth, is that the volume increased. Folks felt comfortable calling, they felt safer, it was less of an inconvenience. And so that gave folks more control over their schedules and their lives. So that was really great. And then on the health side, we saw, I think, a slight increase because of telehealth, certainly not a drop. What we also, though, see are folks putting off some care. So I think if everyone had gotten care when they felt comfortable, we would have had an even higher volume. Katie, do you have anything to add to that?
Yeah. So I think steady pace. There's been some of the hesitancy to arrive to the office, so the telehealth really helped connect some of our patients that did have that, nervousness about going out and being in the offices. But then obviously we are seeing more traffic related to COVID. So we're seeing patients come in, whether that's because they're feeling ill or they are fearful of an exposure, but connecting them to testing and connecting them to providers. We've seen a lot of new patients come that way too. So a steady pace. Some offices have not slowed down at all, like our OB office. We still got pregnant folks that are coming through and need the care. So it's been an adventure, but we are definitely seeing the patients come through.
Why do some people get COVID and other people don't?
Good question.
I mean, it is a loaded question because, and the reason I ask that is that I have heard stories about people who have had direct exposure to someone who has been COVID positive and have not gotten sick at all. And then I've heard stories of people who have had, quote unquote, no exposure and have gotten sick. How does that happen?
I think there's a lot to learn yet. I think there's a group of my girlfriends that we joked about that at least 3 of them or their spouse have tested positive for COVID, but the other one didn't. So it was just 1 per household. And it makes you wonder, with the contagion, like what does it take to make someone ill, and what does it take to prevent them from getting ill? And there's just so much that we're learning. I know that there's studies being done on blood types that are very intriguing. The O positive blood type seems to have some kind of ability to fight off the infection, which is just exciting to find out, things that we don't know.
So
And also,
I'm an A positive blood type, and I've read that I'm the one who might have the most problems, and that doesn't make me feel very comfortable.
right. I think we just have so much to learn on it. But I think too that in learning, we're also learning more about just basic hygiene and disinfection and the efforts that we put forth and how that is impacting other things, such as our flu positivity rate. We're seeing a decrease in that because of some of the efforts that we're putting, towards the COVID fight. So
if somebody got the flu vaccine, are they less likely to be at risk for COVID, or are the two completely unrelated?
They're completely unrelated. The vaccine for the flu, although it's not 100% effective, it does help prevent them from getting those strains of the flu, but they're just completely separate viruses. So that doesn't help one way or another. Of course, it's going to help their overall health if they are preventing the flu.
How much hypochondria have you seen this year?
All of it.
Because I can only imagine that every sneeze causes someone consternation. So the question is, how do you know if you need to be tested? What are the telltale signs that, I need to go get tested?
So a lot of that's going to happen with just a collaboration between the patient and the provider. The provider's going to really dig deep and find out what are the symptoms, what's your exposure. Sometimes patients are tested strictly because of exposure. But a lot of that is dependent too on when that exposure happened. So if somebody was around somebody yesterday, it's not wise to test the next day. It's going to take a few days before that's even going to show up on a positive test. So that could warrant a test. Of course, if you have the classic symptoms of the loss of taste and smell, or just the sinus respiratory issues, that could be an easy reason to test. But everything's complicated, and it really just kind of depends on that conversation between the provider and the patient.
What is that range of hours? Is it 48 hours? Is it 72 hours? How long after you've been exposed do you need to start paying attention to those symptoms?
Well, I think you need to start paying attention right away.
Okay.
They've seen people, develop symptoms within a 24-hour exposure. But according to CDC, we're looking more so between day 5 and day 7. So CDC is recommending that if you don't have any symptoms, that between days 5 and day 7 that you be tested. And then if you do have a negative test between that time period, they do reduce your quarantine time. So that's what CDC is telling you, is to watch between day 5 and day 7. And as long as you're getting a negative test back, then we hope that you're in the clear. It's not a perfect system by any means, though.
Absolutely. So we've talked about physical health. Let's talk about the impact that this has had on mental health. I sit on the Mental Health Advisory Committee with Joe Trollian, and we've launched the Know It Before You Need It campaign. Obviously, we need it. We need it now. To what degree have you seen a rise in behavioral or mental health clientele at 3rd Street during this time?
Well, I can tell you, I've been working with our director of behavioral health, and we are seeing a lot more isolation, a lot more anxiety, a lot more fear. And you wrap all of that into the whole community's feeling some version of that. We're all feeling a little angsty, or a little shut in, or a little isolated from our friends and families. And particularly, I think, for people who are living alone and truly adhering to being careful and avoiding the public, it is very isolating. You don't have that person, you can't even just easily go to the store and talk with folks. And so we certainly see a lot more of that isolation and fear. And I think that's why the behavioral health appointments also have increased, is that folks feel the need for a connection in some way, and we can provide that connection.
Has that exacerbated the substance abuse issue?
Yeah, I think that it's been, even if it's anecdotally, folks know that if you typically use, whether that's drugs or alcohol, and you're isolated or you're shut off from others, you're going to probably use those more, whatever they may be. And I think the bigger concern too, obviously there's some long-term effects that could have. But also if you're using something like heroin and there's no one there with you with Narcan or naloxone if you overdose, there's a lot more fear, and we're seeing some more of the overdoses where people are just using by themselves. And so they don't have that group there to protect them in essence. So that's a big concern of ours as well.
Is the suicide rate higher as a result?
What I'm reading is there's some folks that are guessing that is the case, or they're suspecting that that's the case, but I think it's too early to tell. Mm-hmm. Certainly in the last decade, suicide rates have increased and have been increasing. And, we have pockets across our state and across the nation where we worry because it could be a group of youth that there seems to be a big jump or a rise in suicides, or at least attempted suicide. And so we can suspect that. I don't know that we have a lot of data to tie back to the isolation from COVID just yet.
When you think about all of the people that you have to see, and obviously healthcare workers take a great risk in their profession, regardless of the times, how has the potential risk of exposure to COVID impacted your staff?
So our staff, when we ran into this almost a year ago, I think there was a lot of uncertainty, and it was challenging from a leadership standpoint too, to help secure our staff. But part of that is just researching and having the knowledge. We have a great chief medical officer, Dr. Toward, that has, spent a lot of time just educating our staff and doing the research and spending the time to find out and keeping up with all the changes that are happening. So that's provided a lot of reassurance, and it's also provided us a lot of guidance on what we can do to help protect our staff, whether that's personal protective equipment or if that's testing. We are watching our employees if they are exposed to a patient and finding out just through our own research how much of that exposure is risky, and classifying those exposures into low, medium, and high risk, and determining which ones are more risky than others. But I think having a good leadership has helped provide that security for some of our staff, and then also being able to secure the personal protective equipment, because it was very difficult to find even the most simple of things, from the face mask being an issue at the beginning to gloves and disinfectant wipes, but always just working so hard to make sure that staff have those, because just those basic needs as a healthcare provider became an issue. But having those and having clear guidelines has really helped us provide the best care for our staff so that they can do that for patients.
Are you finding that it's more necessary than ever to debrief and to provide emotional support within in order to keep these people focused on their task?
100%. I think there's been a lot of challenges, not just within healthcare, but we have a lot of young single parents working full time, and then also having to learn how to do virtual learning with their kids, which is such a strain on them and their personal lives. And then having to come to work every day has been also very difficult. So it's giving them the opportunity to talk it out and to help connect them and give them the time off that they need as well.
If you were to think back a year ago, is there anything you would have done differently to prepare Richland County or your constituents for the year that you faced? Or do you feel that you tackled it as best you could?
I think the best thing that came out of this was the collaboration between community partners, and then watching us work closely with Avita and with Ohio Health and the Richland County Health Department. It's been absolutely wonderful to just watch. I think there's not a lot that we could have changed or done differently. Of course, I would have loved to have a stockpile of supplies so that we were ready to roll, but it's really been amazing to see all of these community partners come together to support each other and work together. We had a really hard time having our employees fit for N95 masks. You hear about N95s all the time, but a lot of people don't know that you're supposed to be fit for those to make sure that they're working properly. But Avita really stepped in for us, and they helped fit all of our employees that needed those. So just really crucial collaboration between those community partners.
And I would just say too, from the staffing perspective, I've been here just under 5 months. Katie and her team, I mean, there have been lots of times that we've had to adjust and adapt and figure out how to, manage the vaccine when it came out and what happens when testing stops. And just having a team that can really hit the ground running, that can pivot, that can, in the midst of their already busy days, take the time to figure out how do we best serve patients, how do we protect staff, and how do we be good stewards in the community of providing the care that we know that we can provide, is remarkable. And it's we have just an amazing team here.
What was it like to step into a new role in the middle of a pandemic?
It was fascinating, because a couple of things. I don't meet people without mask on. And so I don't learn their faces as well, or I don't meet them in person. Even my own team members, most of them I haven't seen without mask. And so it's interesting, challenging to get to know folks when you can't shake their hands or go to lunch or even walk up to them and have a close conversation about things. But I also see, I think what I've also learned through that is I get to see them at their best when facing adversity. And that's something that a new CEO, I was inspired by that, because there could be a whole lot of negativity and terrible things to focus on. And most folks are just focused on how do we get the patient seen? How do we get our staff cared for? And what's better than to walk in as a new CEO and know that your team really cares about the work that we do every day.
We're having a lot of discussions in the community about how to cope with isolation, how to cope with loneliness. What is your advice as to how to balance protecting your physical health versus protecting your mental health? Because sometimes the two are at odds.
Yeah, I think, and I'd love for Katie to give her opinion on this too. I think the first thing to know is not one thing won't fit everyone. And so, I've done a couple of things where I have friends and we mask up together, and we're just okay with masking up when we're in the room together. Even it's cold, so it's harder to do, but if you can get out and get physical and take walks with folks and be outdoors, again, it's harder as it gets colder, and I'm very aware of that. If you can do, even if, again, more phone calls, more video chats, I think any way that you can reach out in a way that's comfortable for you and have some kind of connection, be part of some groups, or, if there's whatever your thing may be, if it's faith in church, if they have groups or ways to check on folks. I just think that each of us have our own interests, hobbies, groups that we're part of. And the more that you can reach out and just say, I just need a little help, and to reach out to your peers and do the same for them, it's good.
Katie?
Yeah, and I definitely agree with all of that. The thing that I worry about the most is maybe our older population. They don't have the access to the electronic ways that we communicate. And like I mentioned earlier, I love to check in with my girlfriends over FaceTime or Zoom or something like that. It's not ideal. I don't love it, but those relationships are so essential to maintain and to help fight some of that. I think another piece to, kind of breaking the physical isolation is to, maintain routine appointments with providers. It's a safe way to kind of get out of the house, but also maintain your health at the same time. So something that I keep thinking back to is we started our vaccination clinics last week, and we're serving the population greater than 80, and I had reached down to explain some of the paperwork to one of our patients, and she reached over and grabbed my hand as she was filling out some of her paperwork. And then as I finished, she said, "This is the first time I've been out of my house in over a year." And she said, my son didn't even tell me where I was going when we were going because he knew I'd get nervous. So, by the time she was there, even if she was nervous, we all need that escape from the isolation. And that's something that she could safely do. And she was doing it for not just her physical health, but I'm sure that it helped her mental health as well.
So making safe choices and trying to find alternatives is the best approach. What is the process now if somebody needs to come to 3rd Street? Do they have to make an appointment in advance? Can they walk in? Where are we in the mix on that?
There's a couple different routes that they can go, and it kind of depends on the needs that they have. So for our basic medical services, patients can walk in and be seen at any of our medical offices. They don't have to have an appointment, but of course we prefer them to have appointments just so that we can keep everybody on time, but we will work everybody in to be seen. Some of our other specialties are kind of dependent. Dental is very busy, but they do offer some walk-in appointments for those who are having pain or emergent needs. Someone like our psychiatrist won't have a walk-in appointment slot, but again, we can always connect them to a medical provider in the meantime, so they can schedule an appointment, they can walk in and see us however they'd like to be seen.
And when they come in, they have to get their temperature taken?
Yes, so typically it just kind of depends on the department again. Dental does their own screenings and behavioral health as well, and then medical, you're getting a full workup as well.
So how does the telehealth work? Because, obviously there are things you can do in a conversation or in a forum like this, but the actual ability to touch and manipulate isn't there. How do you work around that?
So there's lots of creative ways that we can do everything that we need to do. Can we do everything over telehealth? Absolutely not. So a lot of it is just good conversation with a patient. Sometimes patients have an automated blood pressure cuff that we can collect some of those vital signs at home. A lot of them have thermometers that they can collect temperatures. So if it's a simple appointment, a lot of times the needs can be taken care of over the phone. But if it's more complicated, sometimes the providers will make an arrangement to have them come into the office. But they can order labs, they can order x-rays, they can do whatever they need to do so they can avoid that appointment time in the office and just come in for their labs to decrease that traffic within the office.
What is your best advice to the population to stay healthy? What do people need to do to be safe right now?
Wash your hands, wear your mask. Physical health is so important, but mental health is as well. Paying attention to both sides of the spectrum, and really just kind of giving yourself some grace. I think a lot of people are just anxious and nervous. This is all new territory. We're all going through it at the same time. And, it's not the same for everybody, but just give yourself a little bit of time each day to decompress and just make those appointments, follow those routine activities that you may have. Just keep safe, keep masked, and keep going.
Peggy, any final thoughts?
Yeah, I would just echo what Katie says. It's a tough time. We're all sick of wearing masks. We're all sick of hearing folks tell you to wash their hands more and more, but those things they work, and they've kept a lot of folks safe, and certainly safer as we're getting ready for the vaccine for folks. So just do your best. That's really it. We're all not perfect, and do your best to keep yourself and others safe.
Peggy Anderson is the CEO. Katie Griffith is the Director of Nursing at 3rd Street Family Health. And you can find out more information by visiting their website, tsfhs.org. 3rd Street Family Health Services, T as in Tom, S as in Sam, F as in Frank, H as in Horse, S as in Snake.org, 3rd Street Family Health. Thank you both for being on Coffee Talk. We do this as a service of WMFD TV News. It is available on WMFD.com for anyone to see at any time, and it is sponsored in part by the Cove Coffee Shop in Ontario. Thank you guys for being on the program today.
Thank you.